Okay. My name is Beth Blakely. So whenever I first come into a room, obviously to do anything with a patient, I knock on the door and I state who I am and I ask if I can come in. And then when I come in the room, I wash my hands, I put on gloves, and first I always ask how the patient's doing, and I ask what their name and the date of birth is to verify that I have the right patient. And then I explain to them what I'm there for, what I'm going to be doing, and ask if it's okay if I do that. Because a lot of the time, the patient doesn't want it done at that time. Sometimes they say no, and then I say, okay, I'll come back later. So I told him, this is my lovely skeleton that I studied anatomy with, and I have all his little bones labeled. So I explained this is George. I explained to George that I'm going to do just a head assessment, which is kind of weird because I'm used to doing a full assessment. But it's okay. So I'm going to do a head to toe, or just a head to the clavicle assessment on him, and he said he agreed. I verified his name and date of birth. I will pull the curtain, and of course I've touched things, but I already have gloves on, so that's okay. Let's see. Okay, so I told him, he said okay to the assessment, and I closed the curtain, and I also usually make sure the door is shut. That way we have complete privacy. So then I've already washed my hands. I've already explained to him what's going on. I put the bed all the way up, or up to my height, so that I'm not breaking my back while I'm doing the assessment. Make sure he's comfortable. Since I'm only doing the head up, he doesn't really have to be laying down for this. He can be sitting up in the bed, so I might raise his head a little bit if he's laying completely flat. That way I can see what's going on. Okay, so first I'm going to inspect the head for size, make sure there's no nodules or any abnormalities anywhere around his skull. Usually I feel behind the ears. Make sure there's no lesions, bruising, redness, bumps, like if they were to have a fall. Make sure there's no lacerations. Okay, I'll also look and make sure they don't have head lice. I'll look at their hair, make sure they don't have no alopecia where they're losing hair in some areas, because sometimes you have patients that pick their hair out as a diagnosis, or lose their hair because of cancer. So I'll look at all that and make sure it's all symmetrical. Let's see. Then I will also, okay, so I did the head. Then I'll look at the eyes and make sure they're completely round, they're even. I'll make sure that their eyebrows are symmetrical, make sure their hairline is symmetrical, make sure there's no bumps on their forehead, make sure their cheekbones are symmetrical, their nose, the mouth when they smile, their jaw, make sure there's no bumps or like swollen redness, if they have pain in their mouth. So then let's see, when I start on the eyes, I always will, so I stay on the eyes first. Alright, so I will take my pen light, and I will tell them what I'm going to do, tell them to look straight forward, and then I'm going to shine a light in their eye, but to look forward at me. So I put one hand here, and I'm just going to shine the light and see their pupil reaction, and see if it's brisk or no. Before I did that though, I will look at their pupil size, what it is before the light shines in there, to make sure that, to see what it goes down to, if it moves at all. Sometimes they're fixed and they don't move, especially if they have to have eye problems. So his pupils were normal and reacted to light. They were a 3 and then they went down to a 2. I will still take my light, and while I'm here, I usually, before I even go to the nose, I will have him look straight at me, and I'm going to test the cranial nerves, and I move the pen forward and then I go up and down, down and up. And then I will also ask him to look straight forward, not to move, and to tell me how many fingers I'm holding up on this side, and this side, and this side, and this side. Kind of the same thing to see how good his vision is. Let's see. Oh, so I will also obviously look before I even do the pupil test to see if he has any, what his conjunctival sac looks like, to make sure there's no redness, no drainage coming out. Make sure it's not dry, it's normal mucus, you know, normal discharge, no discharge, but like normal, no bumps or styes on there. If I do, I will note that. Okay, so I already assessed the light. I assessed distant objects. Okay, so I will also have them do the Snellen chart, have them cover one eye like this, and I will have them read a chart that's at least 20 feet away, and have them tell me what the lowest letters on the chart that they can read, and have them read it with one eye, you know, covering one eye, and then do it with the other one, and then document that appropriately. After doing that, I will then look in the ears. I take my light and I just look in the ears. I'm going to pull the pinna back, up and back, to look and make sure that there's no drainage, no redness. I'll ask them if they have any pain in their ears, if they have any ringing in their ears, because that is very common too, and it's not fun. So after I assess their ears, then I'm going to obviously note the position, make sure they're symmetrical, they look normal, no abnormalities. I already said I'll note discharge if there's any discharge coming out of the ears. Then I will then go to the nose. So I will always look and make sure that the nose looks straight. It doesn't look like that they had any broken noses or anything. Then I will probably place, usually they can't do it, so I place one finger over one nostril, and I'm going to just look up underneath one side, and then have them blow their nose to tell me if they have any blockage or deviated septum or anything. And then I'll shine the light on each side, do the same thing to both sides, to make sure that there's no issues, no hole in their septum, or no deviated septum, no drainage. I'll ask them if they have allergies, any problems with their nose on a daily basis. I will also feel their sinus cavities, the sinus cavity look here, and then I will also palpate over here on their cheeks just to see if there's any puffiness, and since I did ask them if they have any allergies, just to see what's going on there. Okay, so when I look in the ear, I usually take my finger and I'll rub in their ear and make sure that their hearing is good. Sometimes I'll whisper in their ear and tell them to repeat what I said to test their hearing. I also ask them if they wear any hearing aids. I also always ask them if they wear dentures, upper, lower, partial, full, or hearing aids, and if they wear glasses or contact lenses, just so that I can chart that appropriately, because that's a big, huge thing with them getting lost, and we're responsible for that. Okay, so after the ears, the nose is done. I palpate the sinuses. Okay, then I'll go down to the mouth, and I will have them open their mouth and say ah. At the same time, I'll check the uvula to make sure it moves accordingly whenever they say ah. And I'll also look in their mouth for any mysterious broken teeth, see if they have dentures. If they do have dentures, I will have them take them out if they're not already, if they're already in their mouth. And just check and make sure that their gums underneath are not irritated. Make sure the teeth fit right, because that's a huge problem with the elderly, is that they lose weight or they gain weight, and then their teeth doesn't fit anymore, and it's actually hurting and hurting their mouth. So if that happens, then it just need to be adjusted accordingly. Okay, so when I'm assessing the mouth, I look at their teeth, I look at their tongue. I have them lift their tongue up and down. I check the top of the tongue to make sure that there's no whiteness, because candidus is a huge thing with the elderly. They have the white patch on their tongue, and then they need medicine accordingly, and nystatin for that. But that's another issue. I'll have them lift up their tongue because that's a common area for cancer. I'll check the mucous membranes to make sure they're pink and moist. If there's any lesions or any cuts or anything, I will note that also. Let's see. Okay, so, and then I will also look in the back of their mouth and look at their tonsils to make sure that they're the normal size, to make sure they're not enlarged at all, not redness. Sometimes they'll have white patches in there if they're infected. So I will make sure that's all normal, make sure there's no drainage, or I'll ask them if their tonsils hurt, when they swallow, or anything like that to make sure they don't have any issues. Then I'll move on to the neck. And I always, before I go down to the shoulders, I always check the bottom of the neck to make sure that the lymph nodes are not swollen at all when I check the ear. So I'll just kind of go across. That way it's all one motion. I will have them turn their head from side to side to make sure that there's no bulging, to make sure that their carotid arteries are not swollen and bulging, because that is another issue if they're having heart problems. So when they turn their head, I'll make sure that they have, kind of push against me to make sure to see what their strength is, if it's 5 out of 5. And you're checking for range of motion. So I'm assessing the strength. And I also have them shrug their shoulders, because you're also testing for that accessory nerve, to make sure that I hold my hands here and have them just shrug their shoulders. And I'm testing for strength there also, against resistance. And then, so I already palpated the lymph nodes here. And then I'll go on to their neck and just look at the trachea, make sure it's midline. I'll have them swallow and make sure that, just take a sip of water and just make sure that the thyroid gland rises and falls with swallowing. I'll look at their clavicles here and just make sure that they don't look broken or displaced or anything. And I'll also feel the lymph nodes along their clavicle area. I look here just to, kind of palpate and make sure that, lightly touch, make sure it doesn't feel broken or any issues there. Let's see. So, and I make sure I have checked all the lymph nodes, submental, tonsillar, preocular, postocular, occipital, deep cervical chain, anterior, posterior, and supraclavicle. So all those lymph nodes have been checked when I'm doing that also. That's pretty much it with the assessment. I will document every finding, abnormal and normal, both sides bilaterally and bilateral, and make sure that it's equal. And then I always make sure the patient is comfortable before I leave the room. Let's see. Oh, obviously before I forgot a step. Anytime I'm doing the neck, I'm also just feeling the carotid just to make sure that it's normal, the pulse isn't bounding, and I check the heart rate with that before I move on to the radial and all that. So before I leave the room, I ask him if he's comfortable. I would put his bed completely down to the floor. I make sure his call light's within reach. Ask him if he needs anything, make sure his bedside table, his drink, everything is within reach so that we don't have to, because that's how a lot of falls happen, is everything's too far away and they can't get it. Big no-no. So, and I pull the curtain back, make sure he's comfortable, ask him if he needs anything, and then I will take off my gloves and wash my hands before I leave. And that's pretty much it.